Welcome to Medical Ethics Lesson 5 on Confidentiality. Let's begin with a practice question. Why is confidentiality important? Pause the video and have a go. There are many reasons why confidentiality is important. First of all, it's so crucial to the doctor-patient trust and the relationship. If a doctor doesn't keep confidentiality, then the patient will lose trust, and when it comes to diagnosing a patient, it will become very difficult to get details. For something like an STI, for example, the patient might be a little bit ashamed or a little bit scared to talk to the doctor, so confidentiality is essential. Secondly, it's a human right. One of the key principles of ethics is patient autonomy. They have a right to have confidentiality. Thirdly, it prevents exploitation of data, for example, by insurance companies. If insurance companies were able to get hold of NHS data, it would change the whole industry of insurance. But we don't want that because it leads to exploitation. And lastly, it maintains the public confidence in healthcare. Can confidentiality ever be broken? If so, when can it be? Pause the video and have a go. So confidentiality can actually be broken in certain situations. There are three main situations when this can happen. First of all, when there's a risk to a third party. If, for example, a patient comes in with an STI and you know that they're sexually active and they could pose a threat to someone else, then you can break confidentiality. Secondly, reporting road crime via the Road Traffic Act. Doctors don't have an obligation to go to the police for every crime. They are allowed to, but they don't have an obligation to. For a road traffic incident, they actually have an obligation to. So if a patient comes into A&E saying that they've had a big accident where they drove into someone and then drove away before the police came, you would have to report this. And thirdly, there's implied confidentiality when you share things with other healthcare professionals. If a patient comes in and tells you about an STI, it tends to be implied that you can tell your colleague. However, at times a patient might ask you to not tell your colleagues, and you'll have to decide on the appropriate situation based on that specific case. In all of these scenarios, the best case is to actually talk to the patient and explain to them the importance of breaking confidentiality. So for example, if a patient comes in with an STI, you wouldn't straight away go to that person's wife and tell the wife. Instead, you would try to convince the husband 3 to 4 times to tell the wife, and eventually, if the husband still persists on not telling the wife, you might have to intervene. So breaking confidentiality should be the last resort in all of these cases. Let's have a go at some different scenarios and decide whether you yourself would break confidentiality. The patient is 14 and is sexually active, therefore underage. She has not told anyone except you. Do you break confidentiality? No. You should encourage the patient to talk to her parents and tell her to be very careful as she is underage. However, you can't break confidentiality as she actually isn't under threat, assuming there's no STI, or isn't posing any threat. Do you break confidentiality here? A man has an STI but has not told his wife and is not planning to. There is a possibility that he is sexually active. Well, here, you would tend to break confidentiality. Of course, it depends on the situation. You have to speak to the man, talk to him and encourage him to tell his wife. But if he persists on not telling his wife, then you might have to intervene and break confidentiality. A patient is depressed and has had suicidal thoughts. There's no real right answer here. It depends on the case. It's a very difficult situation because if you don't break confidentiality and the patient isn't listening to you, then it could lead to suicide and you were someone who knew something about it and could have intervened. On the flip side, the patient might see it as betrayal, and if they can't confide in their doctor, then who can they confide in? So therefore, you have to be very careful, and it's good to give advice, guidance and support before making any decision on breaking confidentiality. A patient confides in you that they've been using marijuana and cocaine on a regular basis. Do you break confidentiality? No. The patient isn't endangering themselves, and even though he is breaking the law, you don't have an obligation to report it. You can report it and it wouldn't be illegal because you are allowed to break confidentiality to tell the police, but you don't have an obligation to. And in this common scenario you have with drugs, it's often better not to go straight to the police because it can lead to a loss of belief in the medical profession amongst these people. If someone's suffering from effects from marijuana or cocaine, if they know that the doctor would straight away go to the police, they would never come to a hospital again. So therefore, it's important to help treat them because their health is the main priority, and it's not a road traffic incident, so therefore you don't have an obligation to report it. Thanks for watching this tutorial on confidentiality. I hope it helped you, and make sure to keep the tips to yourself.
Thank you for watching this free tutorial from Medic Mind. To unlock 100 tutorials on topics such as MMI, Oxbridge, NHS structure, work experience, personality and much more, click here now.